Ebola. Just the mere mention of the word conjures thoughts of death, agony, and hopelessness. The fatal disease that was once thought of as confined to the African continent has become a global health emergency. The confirmation of the first case of Ebola on U.S. soil on September 30th and news of 2 U.S. health workers contracting the disease while providing treatment have only heightened fears of a possible outbreak in Trinidad and Tobago. But what do we really know about this disease? Are our fears warranted? How do we separate fact from fiction regarding this disease, and how do we prepare ourselves for a possible outbreak? As with any disease, our first line of defense lies with education. Learning about Ebola, its symptoms, treatment, and prevention, coupled with the proper resources, healthcare, and tracing methods, can significantly reduce and ultimately contain the spread of the disease. In this Eyewitness News special report, I will be joined by an expert in the field of microbiology, Dr. Patrick Akpaka, as we attempt to understand the epidemic. Welcome to our Eyewitness News special report, Ebola, Understanding the Epidemic. I'm Selina Ali. The first outbreak of Ebola was recorded in 1976 in the country of Zaire, now known as the Democratic Republic of Congo, near the Ebola River, which is where it got its name. During that same year, Sudan also recorded cases of Ebola. Since then, outbreaks have occurred throughout the years across Africa. The second largest recorded outbreak of Ebola occurred between 2000 and 2001 in Uganda. According to the CDC, a total of 425 persons were infected, of which 224 or 53% died. Those numbers pale in comparison to the current outbreak. To date, the total number of persons infected have crossed into the thousands and affected multiple countries, including the United States, which recorded its first case of Ebola on September 30th. The victim, Thomas Eric Duncan, had come into contact with an infected person while in Liberia before boarding a plane to the U.S. on September 19th. Following his death at a Dallas hospital, 2 of the nurses charged with his care have been diagnosed with the disease. Both are being treated at separate medical facilities in Maryland and Atlanta. Before we head into our interview with Dr. Akpaka, let's first track the spread of this disease. March 25th, 2014, the CDC announces that it has received reports from the World Health Organization and the Ministry of Health of Guinea of an outbreak of Ebola virus in 4 districts in the country of Guinea. A total of 86 suspected cases are reported, with 59 deaths. There are also suspected cases of the disease in the neighboring countries of Liberia and Sierra Leone. April 21st, 2014, the CDC announces that there are 203 suspected and confirmed cases of Ebola, with 129 deaths in Guinea. Of that, a total of 24 cases are healthcare workers, of which 15 have died. July 2nd, 2014, the World Health Organization announces a cumulative total of 779 suspected and confirmed cases of Ebola in Guinea, Sierra Leone, and Liberia. Guinea is the hardest hit, with 412 cases and 305 deaths. It is the worst recorded outbreak in history. July 21st, 2014, the total of suspected and confirmed cases of Ebola crosses 1,000. Sierra Leone has surpassed Guinea in suspected and confirmed cases, with a total of 442. However, more patients are dying of the disease in Guinea. August 8, 2014, the World Health Organization declares a global health emergency. A few days later, the organization endorses the use of experimental drugs, including ZMapp, in the treatment of Ebola. September 30th, 2014, the U.S. records its first Ebola patient. Thomas Eric Duncan, a Liberian, is quarantined at Texas Presbyterian Hospital in Dallas. October 8, 2014, Thomas Eric Duncan succumbs to the disease. Spain also announces its first case of Ebola, a nurse who has treated infected patients. In West Africa, Ebola cases now surpass 8,000. October 12, 2014, one of the nurses who treated Thomas Eric Duncan at Texas Presbyterian Hospital is diagnosed with Ebola. October 15th, another Texas hospital worker tests positive for the disease. The CDC updates the total cases of Ebola in West Africa to 8,997, with 4,493 total deaths. That was a look at a timeline of events for the current Ebola outbreak. On the home front, on October 16, 2014, the Trinidad and Tobago government issued a travel ban on visitors from affected nations, namely Guinea, Sierra Leone, Democratic Republic of Congo, Liberia, and Nigeria. Cabinet has also agreed to establish an Ebola prevention and response team tasked with coordinating and developing a plan to contain and treat the disease should it hit our shores. There is also consideration being given to the postponement or cancellation of Carnival 2015. However, no definitive action has been proposed. When we come back, we'll hear from Chief Dr. Patrick Akpaka as we continue our discussion of Ebola.